Let me call us to order. Are we live? Yes. Okay, let's call the meeting to order. I'm Commissioner Van Winkle. Will be here momentarily. Is that?
That's my understanding.
Yes. So let's start with the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Let's see. Mr. Pratt, you're on. Certify the agenda.
Good evening. Chris Pratt with the County Attorney's Office. All of the items on your agenda this evening have been reviewed by the County Attorney's Office and should be meet legal approval for this evening.
Thank you. Are there any member disclosures for items on the agenda?
No, sir.
No, sir. No.
Thank you. The consent agenda, has everybody had the opportunity to review the meeting minutes and to review the financial report that was provided in the packet? Are there any objections, any questions, or any revisions? Okay. I would seek a motion to approve the consent agenda.
Mr. President, if it's pleased the board, I do have a motion to approve items A and B on the consent agenda.
Is there a second?
I will second, sir.
Thank you. We have a motion, we have a second. All in favor, say aye.
Aye.
Opposed? Great. The motion passes. So our first item on the regular agenda is Kristen Kolstead. Thank you. I asked and I got it wrong. I apologize. As a Benevento, I try to do better.
Hello, nice to meet you. I'm the Assistant Director of Human Resources here at Douglas County. I'm here to meet with you all to discuss performance evaluation for Mike Hill, our Public Health Director. And there may be matters as it relates to this that you would want to discuss that would be best discussed in an executive session.
I think that is the case, and I think we would like to move to executive session now, and then come back down, and we'll have a discussion in public. Of course, all of the financial information is public information. Correct. The discussion among the board about financial matters and is something that warrants an executive session. I would like to offer a motion to convene an executive session to discuss the performance of the executive director as a personnel matter pursuant to 24-6-4024F of the Colorado Revised Statute, and I would seek a motion to do so.
So moved.
Seconded.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? Okay, we will be in executive session. Thank you.
Cool.
There we go. All right, thank you. So we're back from executive session. We will resume our regular meeting. We had gone into executive session to discuss the performance of Mr. Hill and to discuss his compensation. Ms. Kolstead, is there anything you want to add or anything we need to talk about before we start our discussion as a board?
Not that
Anything
I
you
can
wanna
think
add?
of. Nope.
Okay, great. Okay, well, thank you very much. So In executive session, we did discuss the performance of Mr. Hill, and I think, and I will let the other board members speak for themselves, but from my standpoint, he has done a superlative job of continuing to stand up a Douglas County Health Department and doing it in a manner that's consistent with the direction provided by the board and provided by the county commissioners. It's been an organization that's been developed that is flat, which is good for a whole bunch of reasons, not least of which is that it keeps administrative costs low, though it does put some stress on senior management because they have more folks that are reporting to them and they have to be more involved in the details. He's also taken our guidance from last year, and he has developed a succession plan that will help us when ultimately, as all good things must come to an end, he moves on to do other things. That we will have a plan in place that will allow the department, quite frankly, to continue to run in as efficient manner as it has been run. We have been, I think the board has been pleased with Mr. Hill's work, and we are grateful for his continued tenure here and his performance. And I would now open it up to any of my colleagues on the board who want to provide any feedback to Mr. Hill on the record.
Okay. I would like to say, if I could, that he has certainly exceeded my expectations and has created a health department where there was nothing before. And I would certainly hope that he would continue to do that for us, maintaining the programs that he has started, working on that succession plan, but hopefully not leaving too soon.
I'd also just like to add that I've really appreciated your responsiveness when I asked about questions around turnover, what you're doing to keep staff and having more staff satisfaction. So you certainly are using the grant funding for sending people to different types of conferences and developing people more for their career paths. So I've appreciated your responsiveness. I'd say high performer.
Thank you, Mr. President. So, Mike, I've been fully satisfied with your performance. I think you've done everything that we have asked you to do. You are, and you're doing it consistently. Whether it is managing a budget that we have put the challenge in front of you to remain constrained in terms of the direct taxpayer input from the general fund, you have succeeded year over year at this stage of the game, and I think that's excellent. Just to give more detail to the public in terms of the analysis, Human Resources Department provided the board with a matrix of where compensation is for other public health directors, specifically here on the Front Range. The board was able to see those and consider those and know where Director Hill sits with his peers at this time. And then, of course, the HR department was able to provide the board an analysis matrix in terms of known increases in pay based upon the year change in the other counties here on the Front Range, and then options for the board to consider were we to consider putting pen to paper on an actual increase. And during that discussion, time after time, I'll just share in general, and some of the performance metrics that were mentioned by the board up until now were a part of that discussion. And again, I think what I heard was in balance, high satisfaction with the performance of Director Hill by the Board of Health.
Thank you, Commissioner. So now we come down to the discussion of compensation increase for Director Hill. Before we do that, I do want to put a couple of things on your radar screen, Director Hill, that we will be looking for next year. One, turnover rate. There's no concerns with respect to the turnover rate, but we will we'll want to understand the turnover rate, to sort of do an analysis of turnover that's occurred this year, so that we sort of understand why, if we have turnover, why we have turnover, and that we'll want to see some analysis of that next year when we're having this discussion. Further continuing to run an economically efficient department. There's not going to be more money coming to local governments. There's a lot of spending over the last 3 or 4 years, and I think those times are coming to an end. So continuing to run a department that is run tightly and run economically efficiently, I think would be, or budgetarily efficiently, would be very important. So we discussed, and I don't know where my colleagues are at on this, but we discussed generally what a pay increase would look like. We all generally agreed that an increase in compensation was warranted. Particularly, we're still dealing with inflationary pressures, particularly along the front range, and we want to make sure that you're whole, that you're not sort of falling behind from where you were. So we discussed a range of options, and I would like to make a motion to for a pay increase, and then we can have some discussion about it, and then we can take public comment, and then we will vote. So I'm going to propose a 4% pay increase for Director Hill. That 4% would be inclusive of moving the 3% that's currently going into your defined benefit plan over into your, for a variety of reasons, over into your general compensation, your taxable compensation. Pardon?
Base salary.
Base salary. That's right. Thank you. I'd like to propose a 4%. And I think the 4% is warranted for a variety of reasons. We start with that's the average of what other employees in Douglas County have received. So that's what other employees, yes.
I just want to confirm, are you saying 4% and then the 3% in addition to rolled in?
Yeah.
Yes, okay.
Then the
Thank you.
4, yes. I think the 4% is warranted. I think the 4% is warranted for a variety of reasons. First, part of that 4% is just a COLA. Part of that 4% is just going to be maintaining your salary against inflation. I'm not exactly sure what inflation has been along the Front Range, but I believe it's about between 2.5% and 3%. So that 4% would cover you for inflationary pressure on your salary. And then I think the rest would be for an additional compensation for good work done. And it would be consistent with what other employees are receiving. And it would also keep you competitively priced with other public health directors along the Front Range as well. So I'm going to make a motion that we increase your base salary by 4%, and in addition, we roll 3% from your defined benefit plan into your base salary. So that's not an increase. That's just what you had been receiving. We're changing the nature of that compensation. So I would then turn to my colleagues and let them react to that. Then we will move to public comment, and then I will seek a motion and a second. Commissioner.
Mr. President, I'll speak in favor of the plan you've proposed for compensation. I think, Mike, it sounds like it's something that you were hoping to get, and so we definitely want to. We don't want to chase you away. We want to hit at least your minimums that you're hoping for. And as the president said, this kind of deals with the inflationary effect that we've seen this year, while still hopefully closing the gap to let you know that we do approve of the work you've done. You've been performing satisfactorily, and we'd actually like you to keep it up.
Any other comments?
Actually, I'll make one, since I seem to be pretty good at talking. And I will say that, looking at the salaries going up along the Front Range and the degree of talent that we're trying to preserve here, I think that is more than appropriate.
I'd also just like to make a comment that I agree with the 4%, that would keep him whole, and I do believe that it speaks to his level of experience and what he's really achieved. So, agree.
Any other comments? So let's go to public comment. Let's open it up. Do we have anyone in the room? Yes, please. If you would please give your name and the town that you live in, we'd appreciate it.
Good evening, Board of Health members. Fran Santagata from Roxborough, and I 100% support this. I mean, I think it's more than obvious that building a department from scratch and having it grow to be such a well-functioning organization with high-quality people, 4% is very, very reasonable. Thank you.
Thank you. Any other comment? Is there any comment online?
Yes, Mr. President.
If there is a comment online, if the person would give their name and the town they live in, I would appreciate it. I'm seeing Randy Johnson's name pop up, but I don't know if he's on mute or.
Sorry,
There
I
we go.
didn't have a comment. Sorry, yeah, I was online. I didn't realize it was me. I was going for the public comment later on.
Oh, okay.
This is my first meeting, and obviously since I'm on, that sounds fair to me too.
Great. Well, thank you for that comment.
Yeah.
And we'll hear from you later. Okay, so I'm going to close the public comment. I am going to seek a second. I made the motion. Go ahead, Commissioner Teal.
In recognition of the president's motion, I second.
All right, all in favor, say aye.
Aye.
Aye. Opposed? All right, we're all set. Director Hill, anything you want to add? You're looking like you want to say something.
These things are sneaky. I don't think I turned that on. I think Chris did. No, I want to thank you for your kind words, as each year have been kind words, and I appreciate a little money to go with it is always good. So thank you very much, and look forward to being here for a few more years.
All right. I think that's the goal. Okay, let us now move on to the informational items. So we have received written reports from the various, matter of fact, I'm going to turn it over to you, Director Hill. I know you give an update, and then we have written reports from your different programs. Director Hill, why don't you give us give the Executive Director update?
Yeah, and I'm going to do the Cliff Notes version of this because I was asked by the county to have a short meeting tonight, but you kind of blew my plan out of the water on me. Going to skip a lot of stuff here. Influenza and RSV are low, although it looks like influenza might be starting to tick up. COVID-19 has been staying low in our county. We did have a little bit of a run of pertussis among high school kids, but that's a concern because they might go home and infect their infant siblings or cousins or whoever. But I think that's pretty much
You know
under
what high
control.
schools?
I do not. I don't see anybody in the
No,
room.
it's not. That's fine. We can follow
Plus,
up
I
later.
don't think I'm probably supposed to say that on
Okay.
television. Another big month for the vital records people. You notice death certificate sales went up by 1,000 a month, pretty much. That's because we've entered into some agreements with some funeral homes to be their supplier of death certificates. So we're providing them, and we're also doing our own courier service and delivering it to funeral homes in the northern part of the county that we're doing business in Arapahoe and with CDPHE, but they're doing business with us now because we've kind of catered to their needs. So great job bringing money in there. Those young ladies do a great job. One thing I didn't want to skip over here is Dr. Smith is in the back of the room, and Dr. Smith has been our medical officer for the health department since 2022, and he told us earlier this month or last month that he's retiring and moving to Arizona.
All right.
So he'll be leaving us. So we want to thank Dr. Smith and recognize him for his contributions to our department and to Douglas County and wish him well in the future.
Yeah. Congratulations.
And you want to say anything, Dr. Smith? Or, okay. Thank you. And then following that notice that Dr. Smith was leaving, I did a solicitation for a new medical officer because we are required to have one by law. And Dr. Cameron Dastry, who works up on County Line Road, he's in our county. He's a plastic surgeon, holds medical and dental degrees, so highly educated, has agreed to join us as medical officer starting January 1st.
And there's no board action required for that. That's your discretion, correct?
That's
Okay.
just me letting you know that I've fulfilled our responsibility to have a medical officer on board.
Mr. President.
Oh, yes, Commissioner.
My apologies. What was his name?
Cameron.
Dr. Cameron
Dastry.
Dastry.
Dastoury.
Okay. Thank you, sir.
Is there anything else?
No, I think that's enough for me for tonight.
Are there any questions for Director Hill or any of his staff? Okay. Let us move on to action items. Review and approve of DCHD policies. Mr. Burnett, are you here?
Hi, my name is Chris Burnett. I'm with the Health Department and the Quality Improvement Coordinator. We basically have before you a list of 11 different policies, procedures, and standard operating procedures that we would like you to approve. They're basically just filling in some holes. We had a policy, or we have an unwritten policy of how our communication's handled. We wanted to be able to put a lot of these things just in writing so that if there were ever any change in staff or anything, that they would have a set thing of this is how we run the policy. There's four SOPs regarding environmental health of how they conduct different parts of their job. Part of it is an on-call of if you get a complaint, what's the level and how do those go. There's a couple cash handling policies to make sure it's clear on how cash should be handled. And really just wanted to bring it to the board so you guys would know exactly what we're doing and have you approve those.
How do we handle crypto?
We refer that to the county attorney's office.
That's a good answer. Are there any questions? Okay. Then is there any public comment on this specific item? Is there any comment online?
Yes, Mr. President.
Okay, is that Mr. Johnson? Oh, there you are, Mr. Johnson. If you just tell us the town that you live in, we'd appreciate it. Identify yourself and tell us the town you live in. I think you're on mute. Oh, there you go.
Are you asking me again, Randy Johnson?
Oh, well, I was told there was public comment, so I thought maybe you were it.
No, I had put my hand down. I was, like I said, planning on the later public comment. Sorry.
All right, no, okay. My apologies for misunderstanding. There's no comment. I'll take a motion in a second to approve the new and revised DCHD policies and procedures.
I'd like to make a motion to approve the DCHD policies and procedures as presented.
Second?
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? Great. So, Director Hill, would you please discuss the funding received since October 3rd?
Yes, sir. We're proposing that you approve our acceptance of two funding amounts from the state totaling $292,423.61. First is an ELC, which is Enhancing Laboratory Capacity Grant from the state. This is still money that's kind of resonating from the COVID pandemic, but we got another $290,531.61 there to keep beefing up our disease detection capacity. That'll kind of pay for staff to keep going in that area. And then we also, in the Early Childhood Council, part of our business, got another $1,892 that go towards, I didn't study this one well enough. It's just to enhance services for early childhood customers in our county, which is a highly identified as a big need. So anything we can do that makes things better and any little bit of additional money the state would feel like giving us, we want to take it and help people.
Do we have any questions or comments for Director Hill? Okay. Is there any public comment on this? In the room? Online?
No, Mr. President.
Okay, thank you. In which case, I would seek a motion to approve acceptance of funding allocations from the state received after October 3rd.
Mr. President?
We have a motion?
Yes, thank you, Mr. President. I move to accept the funding allocations from the state that were received after the October meeting.
Do we have a second?
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? Excellent. Okay. Then we have our general citizen comment period. Are there any general comments from the public? Are there any comments online?
Yes, Mr. President.
Is this Randy Johnson this time?
Yes.
Great. Hi, my name is Randy Johnson. I live in Laverse. Johnsson. Do you need my address?
No, that's not necessary.
Okay. Yeah, the reason I'm calling in is we have the Brandon cement plant down the hill from our town, and I think they've started doing some abatement, concrete crushing, and the amount of concrete dust has, increased. I'm noticing it on, stuff inside and everything, and I'm trying to figure out where to turn to hopefully get some help to get some control because, I have a cough. I walked out yesterday morning and I thought I smelled concrete. And then I did the same thing this morning. So I think the concrete dust is saturating the air and then it settles on everything at night, so I've sort of coming to you guys to, ask if maybe you can help do something with respect to the concrete dust. I'm not sure exactly what to ask, but that's what why I called in to the meeting. Thank you.
No, thank you. Before you go, let me go to Director Hill. But let me ask you a quick question. So they're doing construction, and the construction is resulting in the dust. Is that right?
What they're doing, they hauled in a bunch of concrete a few years ago, and what they're doing is they're crushing it, I think, so that they can, quote, use it and also move it so that they can add an asphalt plant.
Okay.
Because I think it's covering that area. So, but it really affects us. I mean, we have concrete dust on, everything. So it's just not a good situation. And I just, know with you guys, I'm hoping maybe you guys have some ideas or maybe something can help us out.
Yeah. Commissioner Teal, you had,
Yeah, Mr. President, just to fill in the rest of the board, Mr. Johnson, as a resident of the community of Leviers, has a large portion of the county's general industrial zoning just directly to the east of his community, and perhaps or otherwise adjacent to Mr. Johnson and where he lives. This is an existing facility that has been in use for many years, and what they do is they actually bring concrete in that's been removed from other projects, road building projects, and they crush it down in order to create an aggregate that can be used in subsequent concrete projects for the customers of Brannan Sand and Gravel. And so it is something that we have, the Board of County Commissioners has been made aware of in the past. I think we would probably, to deal with this in more detail, we may wish to turn to Director Hill, and then perhaps County Attorney can offer some insight in terms of the true enforcement authorities for that, as well as then maybe further discussion on the board at the conclusion of Mr. Johnson's comments.
Mr. President.
yes, Commissioner Van Winkle.
Thank you, Mr. President. And Mr. Johnson, I appreciate your testimony. I am been a county commissioner less than 1 week. I was sworn in on Tuesday, but I do believe if you emailed the Board of County Commissioners, we could probably get you in touch with some of the proper folks, because the burning plant and as well as the county is monitoring, I believe, the air and noise and other things around the burning plant. And we could get you in touch with a place to either make a complaint or to view those observations.
Okay, hey, thank you very much.
Thank you, Mr. Johnson.
And-
Thank you, Mr. President.
Thank you. Commissioner Hill, because I have to believe there's some type of permit with some type of dust abatement requirements, but do you have any insight on this, that you shine any light?
We've had similar complaints before, and I believe we referred them to the State Air Quality Division, who has the regulatory authority.
Right. Yeah, I'm just wondering what that authority would be. But that when you've referred that there in the past, has that satisfied the folks that have that have had the complaints?
I would not say so, no, sir.
Okay, yeah, because I'm not sure they actually have the authority. But I think Commissioner Van Winkle, I think your suggestion is the best. And then probably looking at, there's got to be some type of permit with some type of dust abatement procedures. Commissioner Teal.
I'll just offer it right up to the board, Mr. President. We'll go ahead. We do have public works staff that do monitor this. Our enforcement capabilities as a county are constrained by Colorado statute. However, this is something that we do monitor in other work areas around the county, usually involving capital development, so developing new neighborhoods. It's something that we do monitor in order to work as a good partner with that business. This is something we can check out as on our public works, and if indeed it's based on the tools that we use, if it is something worthy to report to the state, we'll go and do it. At the very least, we can let the business know that they're getting complaints, so that's something that they too should probably look to self-enforce.
Right. I think that's a great idea. And of course, there's always nuisance that he could avail himself of. Okay, I don't know if Mr. Johnson's still on or not, but I hope he picked all of that up. Is there any other public comment? If not, I would, yes.
Hello again, Fran Santagata from Roxborough. Just having dealt with this before when I was your emergency manager, we had complaints from the asphalt plant. And what we did was we wanted to gather some evidence. And myself and my hazmat team leader went over to the actual location where the emissions were coming out of, and we went on top of that building and measured the emissions at certain distances. And then we worked with CDPHE because what we had found was it wasn't actually above their regulatory limit for that particular thing. But in the end, if they had been, if CDPHE came out and their emissions folks found that it was above that on a different day, they were the ones that were going to be intervening. So we gathered the evidence, so Public Works here could potentially gather the evidence, doing some air monitoring, which then reinforces what happens at CDPHE. Often this is sporadic, right? It happens when the winds pick up. And so, I think it's important when a citizen can tell you when it's happening and if we can be responsive to it, because that's what we had to do. We had to go out when we got the call, because that would be the greater opportunity to pick up something that was above those levels.
Thank you. And Director Hill, maybe you just want to pick up the phone and call these folks too and say, hey, we're getting complaints at Board of Health meetings about dust. You guys may want to look at it. I think the Public Works folks going out and then Mr. Johnson sending an email in would probably solve the problem.
Yeah, I'll coordinate with Public Works so that
Okay.
we're not inundating them.
Right. Okay. I would accept a motion in a second to adjourn.
So moved.
Second.
All in favor, say aye.
Aye.
Aye. Opposed? All right, thank you all. See you in March.
Oh, by the way, congratulations, Devin. And just one thing you should know,